In this presentation, we explore the evolutionary basis of parental care in humans. We'll cover the background of parental care, the current literature and theories, and suggest where to go in the future with this subject. To begin our research, we asked, how has human parental care adapted to increase the fitness of its offspring?
When we were considering the background of human parental care, we were thinking about the RK selection theory, which I know we talked about in class. I'll elaborate a bit more on that in a minute. And then also mate selection and how that kind of feels like the first step in ensuring that we have healthy children, and that it's our kind of first step of caring for our future offspring. So I know we kind of learned about RK selection theory in class, but quickly just wanted to mention the theory suggests that there are R-selected species, which indicates that they have lots of offspring but are unable to care for all of them to ensure that they survive. And then the K-selected species are the contrast, and they're the ones that have few offspring and invest lots of time and resources into them. Essentially, there is a trade-off between the maximum amount of offspring one can have while still investing enough time in them to ensure survival. It is said that humans, particularly females, are K-selected, but it's also super important to consider that it is definitely possible to have variability of selection. However, before reproducing is even consciously considered, humans are already seeking out optimum genetic variability in their offspring based on their partner choice. We learned in class a bit about the major histocompatibility complex, which theorizes that females have the ability to smell the difference in males' immune systems compared to themselves, and they are more attracted to those with immune systems most different to their own, which maximizes genetic and immunity diversity in offspring. So we thought this was important to mention just because it's kind of like caring for our young before we even get to the stage of actually reproducing. So after coming through the current literature on the evolutionary basis of parental care in humans, we kind of found three themes that were the most important. There was the mother-infant bond and the behaviors that come along with that, the importance of cooperation in parenting, and then also the mental health consequences of poor or absent parenting. The first topic we'll discuss is the mother-infant bond and the studies we reviewed on that. There are many different behaviors that have been selected for that reinforce the mother-infant bond and its importance. We reviewed several studies about the different morphological components that form the mother-infant bond, including the importance of breastfeeding, what immediate skin-to-skin contact does after birth for the mother and child bond, a mother's ability to identify her own child compared to others, and parents' ability to correctly identify infants' emotions. For sake of time, I'll only discuss two of these four. So the first study that we'll discuss was conducted in Russia, and it was to test the importance of skin-to-skin contact between the mother and child in the 2-hour window after birth, which is also known as the critical period. And there were 4 groups. There was babies that were immediately placed on their mother's chest after birth, babies that were immediately put in clothing, then placed on their mother's chest, babies immediately whisked away from the mother and didn't return for the duration of the mother's stay in the hospital, and then babies who were immediately whisked away, and then they returned a couple hours later and stayed with the mother for the rest of the hospital stay. The data was collected 1 year postpartum, and the babies were measured using an assessment called the Parent-Child Early Relational Assessment, which measures maternal sensitivity, an infant's ability to self-regulate, and dyadic mutuality and reciprocity. And the results showed that skin-on-skin contact immediately following birth positively affected each of the variables tested 1 year after birth compared to the groups separated after birth. And they also found that bringing the babies back after the 2-hour separation period for them to stay with the mothers after they were taken away did not compensate for the lack of contact during the sensitive period. So they kind of highlighted the importance of the skin-to-skin contact immediately following birth. So another behavior that intensifies the mother-child bond is the ability for a mother to recognize her own offspring compared to another's. An experiment was done with 21 infant mother pairs, and they tested a mother's ability to identify her own infant by showing photos of her own child with photos of other children interchangeably. And they found that when looking at their own infants, mothers showed much more immediate brain responses in contrast to unfamiliar infants. And basically, this ability to distinguish one's own infant is pretty crucial to parenthood, as it's critical that a mom devotes her own resources and time to offspring that is unquestionably hers, considering that it's in her best interest to pass on her own genes.
The second important topic we found in the current literature on parental care is the idea of cooperative parenting. Humans are the most cooperative species in the world, so of course our parenting style is cooperative also. Whether it's biparental cooperation or cooperation among relatives and friends, humans need help from others to raise our young. Biparental care is one adaptation of cooperative parenting and refers to the cooperation of mother and father to raise children. Humans, for the most part, have adapted this way because of how costly human babies are. In the past, when humans were hunter-gatherers, it would be impossible for mothers to gather enough resources to keep themselves and their baby alive, and at the same time take care of the baby and provide protection for both of them. With the help of the father, though, the mother could give the baby all the care that it needs, while the father provided food and protection. In modern day, this is still true, although sometimes the roles are divided differently, but someone needs to work while the other watches the children. The importance of the father is clear though and without him, children are more likely to develop mental health issues or behavioral problems. While the father is important to parental care, families don't necessarily need biparental care, as long as they have help from relatives and/or friends to raise the kids. Humans are one of the few species to extend parenting outside the immediate family, and our level of cooperation in parenting has really exceeded any other species. We have adapted this way because of how costly it is to have and raise human babies. If you think about it, pregnancy and childbirth are painful enough, and when that's over, the babies are pretty much helpless without their mother. They require so much care and attention that for the mother to adequately look after them and gather enough resources to feed them and herself would be impossible without help. Some researchers have actually proposed that the reason women live so long after they are no longer able to have kids is so that they are always experienced mothers around and available to help new mothers take care of their kids. Or in other words, we have grandparents so that they could help our parents take care of us. Another source of cooperation in parenting is the recruitment of older kids to help to take care of the younger kids. This use of older children is adaptive because it offsets the cost of having multiple children. It allows you to put some of those children to work and lessen your burden while still allowing you to have multiple chances of passing on your genes. Nowadays, humans go so far as to pay complete strangers to look after their kids so they can have time to work, go to dinner, have fun, or do whatever. Nannies and babysitters are really the furthest adaptation of cooperative parenting in humans.
Mental health. Mental health is becoming a more openly discussed topic in today's society, and awareness about these disorders are steadily increasing. Mental health can either be affected by our environment or the genetics passed down to us by our parents. Mental health is an important factor when considering parenting and offspring rearing. Parents must be mentally stable to properly raise children. Parents who are depressed generally tend to raise offspring who are also depressed and who grow up in impoverished conditions. In a study conducted in 2012, researchers concluded that 15% of mothers experience postpartum depression. Although the causes of postpartum depression are still unknown, There is scientific support backing claims which argue that children of depressed mothers tend to exhibit lower IQ scores later in life. Parents who are depressed generally make less money as well, and may subject their children to less fortunate environments. This is not entirely surprising, given the fact that depression leads to low work ethic and low levels of motivation. In conclusion, humans are extremely careful with their offspring and place much, if not all, of their resources in raising their young. This heavily case-selected style is a trademark of human parenting. Not all of the work falls on the parents, however, given the role of relatives and family. Mental health is important when considering family structure, and people who are not mentally equipped to have children may find themselves in trouble attempting to raise offspring. Now more so than ever, studies on mental health and the role of mental health in parental care should be furthered as social media and other possibly damaging technologies grow. Thank you.